idea. This next assessment technique is called a head impulse test. So this is assessing the integrity of the vestibulo-ocular reflex. And this reflex is what helps us kind of maintain eye focus during head movement. It's often used in patients who report frequent dizziness, and it may help identify and diagnose acute vestibular syndromes and distinguish between peripheral or central vertigo. So what I'm going to have you do is come close to me so I can kind of grab your head. So I'm going to have you look at me, keep looking at my nose, and I'm going to move your head. But when I move your head, keep your eyes on me. Good. Good. So when you move your head, your eyes are still focused on me. Now, if they weren't and they moved with your head, then we can kind of get a sense that there may be some dysfunction in that reflex. And the last kind of technique in terms of a neuro assessment that's been developed is really techniques used to assess patients who are maybe sedated or aren't awake and alert like you are. One of them is the supraorbital ridge pressure technique, and then the other is the trapezius pinch. These are techniques that are similar to a sternal rub that we use to kind of simulate a noxious stimuli and see kind of a patient's response to that. So what I'm going to do first is I'm going to do the pressure, the supraorbital pressure. So really what it is it's just coming here and putting pressure. And now if you were a patient that were maybe more sedated, you may not have a response to it at all, or you may respond to it. And then the other is the trapezius pinch, which is really just coming behind, pinching back here, and seeing kind of if you have any response to that. So again, this ties into kind of a body system assessment, individualized to the neurological system. Crucial to getting us to kind of understand the functioning of this one body system and maybe identifying individual needs. And then we can help patients in patient care and maintain a safe environment for these patients. That's it.
Wonderful.